15 years after California and most U.S. states settled with big tobacco companies for more than $246 billion, public health watchdog groups report little of that money is actually being spent on smoking prevention or to help smokers kick the habit. Debra Kelly, Regional Director of Programs and Advocacy for the American Lung Association in California, joins me with further details. And welcome, Debra.
Thank you.
Now, the American Lung Association, the American Heart Association, along with about 6 other or so public health groups, released the Campaign for Tobacco-Free Kids new report titled Broken Promises to Our Children. What promises are being broken?
Well, when we taxed people for using tobacco, and then when we negotiated the Master Settlement Agreement, we were supposed to create a world where kids wouldn't start smoking. They would have the tools that they would need to just avoid all of those enticements. The tobacco industry wouldn't be able to get its hands on the kids and prey on them. And certainly if they did start smoking, then we would be able to help them stop as quickly as possible.
And the report did rank California as 23rd in the nation for the amount of money spent on tobacco prevention. Specifically, in the current 2014 fiscal year, there is $1.5 billion of tobacco revenue generated in California. The Centers for Disease Control recommends $441.9 million of that money be spent on prevention programs, but just $64.8 million out of those billions, or a little more than 14%, is actually spent on tobacco prevention. What can you tell us about that sliver, that $64 million, on how it is being spent?
Sure. Well, you know, part of it is spent on the California media campaign. People may remember seeing the advertisements with, you know, the secondhand smoke drifting through their apartment, the gal who was smoking cigarette through her, you know, those kinds of things. Part of it goes to the health departments because they manage what's happening locally and they determine, you know, what's going to work for their own communities. A good part of it, about 28%, actually goes to our schools, to the Office of Education, and then to our local schools. And then another part goes to local community organizations like Vista Community Clinic and Communities Against Substance Abuse, the American Lung Association, and we work on hard-hitting policies that really protect people from secondhand smoke where they live, work, and play.
Okay. Now, I know a lot less people nowadays are smoking than before, but the medical cost of tobacco still has a significant impact, even on non-smokers. The report also found that it works out to a little more than $600 a year per California household and nearly $3 billion in Medicaid cost, with a total of about $9 billion in related health care costs. How does spending money on tobacco prevention programs impact health care costs associated with smoking?
The kind of diseases that tobacco can bring about, things like lung cancer, heart disease, chronic obstructive pulmonary disease, are very, very expensive to treat. One of the things we know is if you smoke and you don't quit successfully, you have a 50% chance of getting one of these diseases and dying. And they can disable you, they can kill you, but certainly you're going to be addicted to nicotine. So it's the classic, you know, an ounce of prevention is worth a pound of cure. We're paying a lot of money to treat these diseases. We're investing very little in preventing them.
We asked the county to join us, but they were unable to for this conversation. What can you tell us about San Diego County's share of the tobacco settlement money and where that money is being spent here?
Well, the good news with the county is that they at least are spending all of their money on health-related programs. It would be hard to say that they, you know, what they're really spending on tobacco-related programs. You know, most of what the county does is funded through either, you know, the tobacco tax revenues they're getting from the state or from some new grant money from the Centers for Disease Control. I think for the county there's an opportunity looking at their 3-4-50 program where 3 habits cause 4 major diseases and account for 50% of all deaths. For the county to do more with this money that they're getting through the Master Settlement Agreement and do more in tobacco control.
But the money that's not being spent, the money that the CDC recommends, where is that money going?
Well, it goes to different programs that the health department is doing. So it'll go to HIV programs, it will go to educational programs. It's kind of diffused throughout what
Not
what the county's doing. Not specifically to tobacco.
Counter tobacco, okay.
Yeah.
And just our last question, we don't have a whole lot of time, but what do you think it's going to take to get the state and the county to spend more money, more of that settlement money, according to the CDC recommendations?
Short of a miracle, it's really going to take a lot of pressure from agencies like mine and from people in the community to say, you know, we deserve better than this, and we want you to invest in programs that are going to help our kids, our families, and our community.
Okay. American Lung Association's Debra Kelly, thank you so much.
Thank you.